Hi guys, welcome again to my third video in regards to how easy it is for you to detect HIV/AIDS. We are at stage 4. So before we did stage 3 and we had done stage 1 and 2, which you can also check and so that you understand right from stage 1 to stage 4 what are the disease conditions and how can you easily detect them in an individual. So thank you and welcome. Now, stage 4, we previously spoke about stage 3 and we saw some symptoms, signs, disease conditions associated with stage 3, where we are talking about TB, pulmonary TB, loss of weight for more than 10% of an individual's initial weight, persistent fevers, which can be caused even by TB itself. We are talking about even oral candidiasis, where you have white patches in the mouth, usually painful, and they can easily be scraped off. And we spoke about oral hairy leukoplakia, which is also a disease condition, though caused by the virus, but it appears the same way as oral candidiasis, almost the same way as oral candidiasis, but that one cannot be scrapped off. We spoke about also, issues in regards to, cheilitis or, like stomatitis, recurrent infection in the mouth. Something I may not have mentioned is actually severe pneumonia. The very severe pneumonias also put infected individuals in stage 3. So, and of course, we know what pneumonia is a lung infection, and people present with difficulty in breathing, present with loss of weight, fevers, and just, even anemia. Individuals will have with issues to do with their breathing, especially. Breathing becomes an issue. In severe forms, people can have a lot of complications, including complications that may end up affecting the heart of that individual, including complications that may include fluid accumulation around the lung and then impeding the normal expansion and contraction of the lungs. And that individual will really have labored breathing or difficulty in breathing. Now, stage 4 is the bomb. Stage 4 is the bomb. Just like cancer, stage 1, 2, 3, 4. 4 is serious, also in HIV is serious. Now, in stage 4, we have a number of disease conditions. One is people will have what we call HIV wasting syndrome. HIV wasting syndrome is where somebody becomes very emaciated. People lose a lot of weight. You meet individuals, see individuals, and it is very conspicuous. They have lost a lot of weight, significant amount of weight. Unfortunately, some people even lose up to 50% of their weight. Somebody who was 70 kg start measuring 35. 35 is basically your skin and your bones and maybe some blood that is still surviving inside your system just to keep you healthy, unfortunately. So that is what we call HIV wasting syndrome. Most of the time, we say the person is cachexic. Is cachexia. Cachexia is severe wasting, and then there is these severe forms of pneumonia also that individuals might get. Sometimes actually they are not severe according to the symptoms, but just by the fact of having that pneumonia is severe because of the kind of treatment that is required, and it's not the normal typical pneumonia, is a typical pneumonia. So there is a type of pneumonia called pneumocystis carinii pneumonia or Girovesi pneumonia, whichever way, or PCP, PJP. So this is a fairly common disease condition in HIV, and that classifies an individual in stage 4. So that is usually a condition where people get pneumonia, which will present with the same pneumonia symptoms. Sometimes the symptoms are very insignificant, but you may even take a chest X-ray and you see nothing. Sometimes people have it and they don't know until they start getting worse. So that's what we call PCP. Don't worry about it. Just remember pneumonia, although we still have pneumonia in stage 3. Then we have extrapulmonary tuberculosis, XTB, that is not now within the lung, is outside the lung. Remember, TB, just like HIV, can affect any part of your body except the hair and the nails. So if you have TB anywhere else apart from your lungs, that's what we call extrapulmonary TB. And that is already putting somebody in stage 4. Then we have a number of cancers that are associated with HIV, cervical cancer. Cervical cancer in an HIV-infected individual, stage 4. Doesn't matter what is your CD4 count, what is your general appearance, doesn't matter. Then we have what we call lymphoma. It should be non-Hodgkin's lymphoma. Basically, remember, lymphoma is a type of cancer that affect the lymphatic system. So lymphomas, you may also present with the cancers, what we call lymphomas. Then we also have another cancer we call Kaposi sarcoma, which is a cancer of the connective tissue, the fat, the layer of tissues under your skin or your epithelial cells. So that is what we call Kaposi sarcoma. Usually this presents with purplish skin changes, usually that hardens, becomes purple, and the worst, it can go actually into your airway and your digestive tract. I've seen an individual who had Kaposi sarcoma. The first case I saw about Kaposi sarcoma was an individual who had very high CD4 cell count, but had Kaposi sarcoma, and it could not even be understood. And that's why there was misdiagnosis in a number of hospitals. That was in Kilifi District Hospital. This individual had come from other facilities, but he had been misdiagnosed because his CD4 count was not supporting the possibility of Kaposi sarcoma because it was too high. Usually the Kaposi sarcoma or even stage 4, you expect somebody to have a CD4 count of less than 200, but it's normal or it's common to find people with a high CD4 count, but in a certain stage that she should be having low CD4 count. Anyway, the individual, we managed to try to manage, give chemotherapy, intralesional chemotherapy as well. This individual, unfortunately, while I moved to another employer, I was told the guy died. Then we have, those are the three cancers which I have mentioned. Then we have what we call recurrent septicemia. So these individuals always have infection in the blood. Sepsis is infection. Emia means blood. So the individual will present with infection in the blood every time. And if you have bacteria or usually bacteria in your blood, what will happen to you? Because that is now directly into the blood. Bacteria are secreting toxins. They are actually even contributing to break down your blood cells. So you're going to end up with a lot of problems. They can even go and get entry into your brain and cause what we call meningitis or encephalitis. So people will present with bacteremia, but that is the doctor to tell. However, remember, with what I have explained, the bacteria is in your blood, so expect anything from breakdown of red blood cells, that is anemia, breakdown of white blood and low immunity, bleeding tendencies because platelets are being interfered with, general physiological impairment because the bacteria are producing toxins. Those toxins can even penetrate to the brain. The bacteria itself can get meningitis, and you know what meningitis does. People present with those central nervous systems, confusion, disorientation, convulsion, and you have even some going to coma, stiff neck, vomiting, severe headache, problem with vision, all those. Another disease condition is what we call cryptosporidiosis. Cryptosporidiosis is a diarrheal condition. Cryptosporidium is a protozoa that causes, diarrhea, especially. And actually is a zoonotic disease. It comes from animals. Anyway, forget about that. So individuals will have this chronic diarrhea, cryptosporidium, usually copious amount of diarrhea that drains a lot of fluid from individual's body, and it can be chronic. It can last for a very long duration of time. And its sister is called isosporidium, which is also another disease condition that is caused by protozoa, and it's a diarrheal condition and causes chronic diarrhea. Some will have HIV encephalopathy where people get affected. The virus itself affects the brain of that individual, and you know what to expect. Just like meningitis, you'll have issues like confusion, disorientation, coma, convulsion, anything that you'll think about your normal brain functioning. So most people will also get, not most, some people, HIV encephalitis, yes. Then you have what we call esophageal candidiasis. Remember I said candidiasis in the mouth, those white patches I was talking about in stage 3. is stage 3. But now if that goes to the throat, what we call, down below the throat, what we call the esophagus or the food pipe, then that becomes that becomes stage 4. Just like TB. TB of the lungs is stage 3. TB anywhere outside the lungs is stage 4. So this one as well. Candidiasis in the mouth, stage 3. Candidiasis outside the mouth is stage 4. In the esophagus, it can even go all the way up to your, lower digestive tract. Then you also have what we call chronic herpes simplex infection. So people start getting this viral infection. Like the way you get flu and it cracks around your mouth and some vesicles also accumulate. That is herpes simplex. So herpes simplex can be anywhere on the skin with HIV. It can be anywhere around your skin, in the mouth, what we call mucosal surfaces, and also the skin. So then, of course, recurrent severe bacterial pneumonia. This one now is current. Remember, in stage 3, we just said pneumonia, severe pneumonia, but this is now recurrent severe bacterial pneumonia. And maybe last but not least, these individuals will be bedridden for more than 50% of the individuals' time. So most of them will be bedridden. So these are the signs and symptoms of HIV/AIDS according to staging. Please remember them. You see anyone with such a sign and symptoms, you never know. Just advise them to test. Does not discriminate. HIV does not discriminate, so don't be fooled. However, remember, testing is very important, and the main important issue, that main important agenda of our healthcare system in Kenya, is to ensure that HIV is prevented, then early diagnosis, then early treatment, and then of course management of eyes, and all that in one shell, to ensure that we keep HIV rates low, and also we keep those who already have it healthy and live their normal life. So welcome. If you like this, you can subscribe to it, you can leave a comment, and always remember, I'm here to drop more and more videos in regard to health and many other related topics. Bye and welcome.